All right. Good morning, everyone. Well, I think I know all of you, but I still want to give you a brief introduction as a formal, seminar that probably you don't know all the details. I joined Rutgers in 2008, and before that, I worked at Purdue University. All my past 23 years almost that I work on urban pest management. And today I want to share with you about some of our research in urban pest management, especially their relationship to the public health. You probably know that in the urban environment, there are a lot of pests, especially in low-income housing. As the most urbanized state, New Jersey has many apartment buildings, and all of them have pest infestations. We did several surveys. For example, in 2018, here in New Brunswick, among the 1,225 apartments, 28% have roaches, 11% have mice, and 8% had bed bugs. It's very high percent. Then in another survey conducted in 2022, this one was conducted in 4 cities. Again, you find a high percent infestations in these apartments. And very similarly, that the first and the most abundant species is the cockroaches, then followed by mice and the bedbug. So these are 3 most common indoor pests in New Jersey, but also in the US. Maybe the second and third one may switch in some states. But this is very typical in urban cities. The problem with this infestation is that they are not only causing economic loss, but also affect people's health. So in low-income housing, so why you have high percent of pest infestation? There are several factors. One is that the lack of maintenance of the building, because the lack of financial sources. So many times when there is a damage, they don't repair properly or immediately. And people also do not maintain their apartments well. So you find a lot of apartments with poor sanitation, garbage, spilled food, etc. All these contributed to the abundance of different pests because they provided the food sources, water sources, and also the hiding place. Pet food and the water on the floor is a perfect example that, during the night, the roaches, mice will come out, eat the food. The pet food is ideal for cockroaches too. Another factor related to the prevalence of pests in low-income housing is the people's tolerance to pests. So we found that for people who are more tolerant to pests, they also have a higher likelihood to have cockroaches and a greater population size, right? So this is closely related. Plus, those with poor sanitation is more likely to have cockroaches than the apartments with better sanitation rating. And because sanitation certainly provides the cockroaches with the food, depends on the level of sanitation. The low-income housing also have a very high percentage of people with asthma. So this was in 2008. We did a survey. This is in Indiana. 13% of the residents had a doctor diagnosed with asthma. At that time, the national average is about 6 or 7%. So it's about two times of the rate of the national average. So per household, 36% of people have asthma. So you see the very high percentage. So why you have a higher percent people with asthma? Because the indoor environment, they have pest allergens, mouse allergens, cockroach allergens, they have pest residues. Then also the indoor air quality is poor. Then you have mold, moisture, etc. Actually, all of these are related to healthy homes. So that's why we're concerned about both pests and the pest allergens. And from actually 2004, we have been working to try to control the indoor pests, but also their allergens. The amount of allergen in the environment is closely related to the population size. So here is a graph showing the cockroach count on the horizontal axis and the concentration of the two allergens, BLAG1, BLAG2. So these are two most common allergens associated with the German cockroach. And both of them cause asthma and also cause allergic reaction. I'm quite allergic to cockroaches. I'm sure if I test against these two allergens, I will be very sensitive. So basically, the higher the cockroach counts in the apartment, the higher concentration of these two allergens. And most of the homes with cockroaches have allergens above the threshold that would cause asthma. So think about that. So if you have roaches, you really want to get rid of them. So here is an example of a heavy infestation in an apartment. So we place a jar with bread and beer to attract the roaches. In one night, you can catch 100 roaches with beer and bread. Actually, it's a very good way to attract them and catch some roaches. So all the roaches are from one apartment, just one night. So here is another one that shows the where the roaches are hiding. So usually in the cabinets above and below the sink. And in this case, it's above the sink, because that's where the water is. Close the sink so they can get the water easily. Now you see the inside of the cabinet is very dirty. You have spilled condiments and dead roaches, the egg cases, etc. And this is the occupied apartment. So you see the roaches on edge, also the fecal materials, right? All of these live dead roaches and the fecal materials contain allergens. And some people would tolerate the presence of roaches, even within so many. Besides cockroaches, the second most common pest, at least in New Jersey, is the rodents. There are two species basically abundant. One is the house mouse and the norway rat. The other is the norway rat. House mouse usually occur inside, and norway rat normally occurs outside. All of them carry pathogens. The most famous is the Yersinia pestis, which causes plague. And then the other common ones are the Rickettsia, Leptospira. These are the bacteria that can cause serious disease. Then they also carry ectoparasites. And these ectoparasites can also carry pathogens. The most common ectoparasites that bite people are the fleas and mites. And you probably also heard and saw those presentations by Jinja and Chinji. That both mice and norway rats carry the ectoparasites. And then each species also produce allergens. Mouse allergen is the moose M1. The rat allergen is the rat M1. And all of them are closely related with the asthma severity. So actually, we did a survey that was in 2008. So families with mouse infestation are 1.9 times more likely to have asthma patients. And I'm not sure if you do this study again for rats, you probably have a similar association. Then the third public health important pest in apartments is bedbug. Bedbug research about 25 years ago. In the past, you never really heard that. but they are always present in African countries, Southeast Asia, etc. But only in the last 25 years become common. There are many reasons, like the travel, resistance, the lack of effective pesticides, etc. Because they run human blood as food, so they can cause significant pain, itchiness, or allergic reaction. And some problems can have the bed bugs for many years, like this one. I think I had 8 years. And this is a really heavy infestation. So we brought back the sleeping bag. From it, we got more than 2,000 bed bugs, just one sleeping bag. So you can imagine, some apartments can have hundreds of thousands of bed bugs. Then they become the source of new infestation. And we did actually a study in apartment buildings. So we first collected the bed bugs, then marked and put back. And we found that the bed bugs would spread to the neighboring units, either on the left, right, or downstairs in this case, within 2 weeks. So the dispersal rate is ranged from 0% to 5%. We did this in 6 apartments. So this is definitely, evidence showing that cockroaches can spread through the common wall, through the hallway, or through the ceilings to different units. Similarly, cockroaches do the same thing. So here is a spatial distribution pattern of the German cockroach in a 13-story building. The different colors represent the level of infestation based on the habitat. The red one would be more than 50 cockroaches over 2 weeks period. Now, if you look at the top floor, the left side, the 6 apartments, none of them have rating, but on the right side, all of them have. If you look vertically on the right side, you can see the top 3 floors all have a cockroach. So basically, statistically, when one apartment has cockroaches, its neighbor, whether on the left or right, across the hallway, or above below, more likely to have roaches, because the cockroaches can easily spread through the common walls, pipes, etc. And we also did this for the mice, and I will not show you. So basically, you can see that in multi-unit developments, you really need to do building-wide control or community-wide control in order to eliminate or suppress population. But people tend to do themselves, and they don't know how to do them well. So for example, 78% of people tried to control themselves because it's cheap, it's convenient, etc. But if you look at the methods, 55% use a spray. That's the top method they use. But the spray really is not an effective method because of resistance. The most effective method for cockroaches is use bait rather than spray. And people also use ineffective materials such as the electronic repeller devices and total release soap. There are a lot of things that you really don't want to use, but people use. And because people use a lot of sprays, then they end up contaminating their environments by leaving some residue. And we found that 71% of the homes with cockroaches have a detectable insecticide residue. The number of insecticides per home depends on indication of bedroom. Is from 3 to 5. So which means they use at least 3 to 5 different kinds of products. The top 5 insecticides found in homes are all peripheral: permethrin, cypermethrin, deltamethrin, lambda-cyhalothrin, and the imidacloprid. If you go to Home Depot Lowe's, check the labels. Most of them contain these chemicals, and that's also people use in their home. Here on the left side, you see some examples of consumer products on the left and the professional products on the right. The residents tend to use baits, dust, spray. The most common spray they use is the reed, ant, and the roach spray on the top. However, while they are cheap, they are much less effective compared to the professional products. Well, in theory, everyone can get professional products from the web or from the distributor, but most people do not have the knowledge on what to use and how to use. For example, for gel baits, the most effective baits are the this one. Let me see if I can put that. Let me use mouse. So this one called Max Force FC Magnum, Max Force FC Select, OptiGuard, Admiral. Those are the most effective gel baits. So even the professional products have some differences, but most people wouldn't know. So how would you successfully manage the urban pest? So that's using cockroach as example. So we all recognize that IPM is the long-term sustainable solution for cockroach control. It consists of education of the residents and staff so that they can keep the environment clean, reduce clutter, avoid using ineffective sprays, monitor eating glucose, using effective materials such as base, boric acid dust, and then evaluation. So do not stop the treatments before they are eliminated. You need to continue the treatments until elimination. Well, we did several studies, and fortunately, most people and most even the contractors, they really do not follow the IPM protocol. So here we did a study, just want to demonstrate how effective is the IPM. So this was done in New Brunswick. So we give them educational materials, we apply the bait, boric acid dust, and for 30 weeks, we found that there was 85% elimination rate. The cockroach counts reduced almost 99% from like 38 to 2. So this was published. So you can see that as long as you follow that IPM protocol, you can get very good results. But that's the research. How you can implement this by communities. So one of our grant program is to help housing authorities to adopt IPM themselves. So in this grant, we try to educate the residents and the staff by showing them what kind of material they should use, and also some biology and the prevention methods for the common pests, basically 3 pests: cockroaches, mice, and bed bugs. So I went to different housing authorities. Here is the leading housing authority. And in each event, we provided with some, here you can see the flyers, glue boards, traps for bed bugs, snap traps for mice, some live roaches, bed bugs as the demonstration. We also did a post-seminar survey, just want to evaluate the effectiveness of the education. Here is the Pests Housing Authority. Here's the Millville Housing Authority. So we did this in total about 6 housing authorities, but each housing authority have many different buildings. So in total, we collected 176 questionnaires in different cities. The questionnaire is very simple, only 6 questions. And from this, we can determine how effective is the on-site assessment. The first question is, do you have existing pest infestations in your home? 28% said yes. This rate might be low because many people do not recognize the pest. So you have to keep in mind about that. Second is, have you purchased or used a pesticide within the last 6 months? So 30% said yes. You see, a very high percent use pesticides. Then we ask the rank the importance of the following factors when you select the pesticides. Majority of them said safety. People actually value the safety more than other factors. The fourth question is, after today's training, do you think it is a good idea to use sprays to control cockroaches? And 36% said yes. during the presentation, I want to stress that the sprays are not effective. However, the 36% still said yes. So which means that even though you tell them which is not good, they still don't remember right after the seminar. So you have to keep in mind that you probably have to give multiple presentations, or you have to give more details so that they can remember. Or maybe they simply don't want to pay attention. The fifth question is what changes will you make regarding pest control? Actually, you can see the top two would be better sanitation and then reduce clutter. But this is what I stressed during the presentation. That the clutter sanitation provide the food and hiding places for the common pests. And people remember that, which is very good. However, during the seminar, yes, they were listening, they said that they do this or do that. But would that translate into reduce pest infestation? So to evaluate the effect of IPM education and the provision of control material, we did a study in New Brunswick to evaluate whether they would reduce the cockroach infestations. So this is New Brunswick Housing Authority. They have about 250 units, all two-story building. And first, we went to all those apartments, lay traps, and then find out which one have roaches. Based on that, we did 180 apartments inspected. 26% of them with pests were interviewed. Then 35 apartments have cockroaches. From these, we divided it into two groups, education and control. And then during the process, 3 exited because they vacant or data missing. But eventually we have 12 in education group, 17 in the control group. The education group actually received both education and control material. So we use the traps to monitor the cockroach population. We place the one in the kitchen cabinet, one beside the stove, one beside the refrigerator, and one beside the toilet. So these are the primary locations where you will find the roaches. And after 1 week, you go back and check. So typically, you find a few dozen. I think the median is about 20-something, but sometimes you have 400, 500. In the education group, we give them glue board, flyer, gel bait, and boric acid for cockroaches. I will show them how to use them. We also will ask them to keep the apartment clean, reduce clutter. This is a flyer, how does it look like? I mean, you can also find this on. So this flyer basically gives you some very brief information. So why cockroaches are important, how to prevent them, how to monitor and control it. For people who speak Spanish, they with the Spanish word. Based on the initial survey, we found that most of the residents are female, and the age group is split between senior and non-senior. And most of them are Hispanic. The second is African American, white only 4%. This is across the New Jersey, very common, that the primary ethnicity is Hispanic or African American. White is very few. Sometimes they have some Asian people. In terms of sanitation, 17% rated poor or very poor. So actually, majority of them are good or average. Now, if you look at the results, so we first gave the education, the materials. 1 month later, we went back or check if they use, if they still need more materials. Then we would give more materials if they need. Then we'll check again at 6 months. We would use the same method, placing 4 traps per apartment for overnight, and second week we collect. So we found that the geometric mean of the cartridges reduced by 99% in the education group, the blue one, and in the control reduced by 51%. So this is significantly different. So in the 1 month period, you see also actually look like a significant, but really not. The variation is not. The infestation rate also decreased by 58% in the education and only 6% in the control. So by similarly giving materials and give them education, you can significantly reduce harmful infestation. And I hope we can also do this in apartments for mice and for bedbugs in the future. Of course, this probably need a totally different approach. They, they actually may need more skills to control bedbugs or mice. So eventually, we wanted to expand the IPM education program to more housing authorities. In New Jersey, there are more than 100 housing authorities. Around 300,000 people live in low-income housing. So actually, it's a huge task to educate all of this. And actually, many times, you try to approach them, give them free education, and many of them actually are not interested. So once they know you, they know the benefit, they would actually welcome to go to the facility. Well, doing this certainly can involve some extra work for them. So you have to persuade them why this is important, why would benefit them instead of giving them burden. So we also want to evaluate the long-term benefit of IPM. So right now we only did 6 months, but what happened if we do longer term? Will the further reduce? No. In that study, we basically reduced the rate, the infestation rate by 58%. Can you further reduce after long term, more than 1 year? Right? I also want to study the pesticide residues. I think that once people reduce or stop the use of sprays, you would have much less pesticide residues in homes. Also, less asthma severe patients or expensive related to asthma. So actually, HUD, the U.S. Department of Housing and Urban Development, they are interested in not only to reduce the pests, but also provide a healthier environment. Healthy environment means less allergens, less other health hazards, especially related to asthma. And lastly, we want to compare the different education strategies. Give them materials, certainly, at least right now, helps tremendously. But what if you only do the education alone? So you want to make sure that your both education and materials are valuable. Right? So if education alone doesn't help, then probably you don't need education. So how would you basically to spread or augment the IPM program more effectively, more efficiently across the state or even to other states? Right now, very few people do this kind of work because certainly it's hard. The low-income housing has a lot of challenges, and how you can, make this as a priority compared to many other issues facing them. So let them to buy in is a challenge. Actually, I still have 15 minutes. So at last, I want to thank the housing authorities, the funding agencies like the U.S. HUD. They have called Healthy Homes and Lead Technique Studies. So actually, I have been very lucky to be able to get funding from them for the last almost 20 years. So they really like our work. Actually, New Jersey is special in that we have many housing authorities. So we have the advantage that we can deliver, very good data and showing the benefit of IT. USDA NIFA crop protection and the pest mandate. They have a grant program called IPM in housing or IPM in other facilities also. But anyway, IPM in housing is one of their focus, which is good because we basically, actually, this is the result of our work too, because we provided a lot of reference data, referee journal publications to US HUD. Eventually, HUD gave money to USDA NIFA, saying that can you also add housing IPM in housing? So this is some actually development as a result of all this. And the third one is Northeastern IPM Center. Unfortunately, last year they dissolved. They're no longer present. I hope they'll come back because of lack of funding from USDA. Graduates used to have called a Community University Research Partnership grant. I got 2 of those. Unfortunately, they stopped in 2019. So after that, we were never able to do any more research at New Brunswick, except the HUD, sponsored research. So during the past, I guess here in New Jersey, about 17 years. So we developed the relationships with probably more than a dozen housing authorities, and we still keep contact with them. And hopefully, we can, collaborate with them continually to, apply for grants and also collaborate with manufacturers to do some field trial. And lastly, I want to thank my lab members. All are here. No, except 3. 3 is last one. He went to USDA.